This is the West Caldwell Public Schools 2024 Open Enrollment webinar. I am Elizabeth Roldan from IMAC Insurance. I'm here with Maureen Peterson as well from your district. IMAC Insurance is the district's insurance broker. We can help answer any questions related to open enrollment, but also regarding any claim matters or benefit questions that you have throughout the year as well. Karen and I in our office deal with a lot of claim matters, benefit questions, so please feel free to reach out to us anytime. You can give our office a call at 973-450-9800, or you can send us an email at info@imacagency, and we will get back to you. Especially now during open enrollment, I am making it a point to get back to people as soon as possible, same day, within the hour if possible, because I know that time is running out. Open enrollment ends October 31st, and we want to make sure that you have all the information that you need in order to make an educated decision as far as what plan you will be in for the 2025 year. Open enrollment began on October 1st, and again, we'll be running through October 31st. That October 31st is a very hard deadline. It is not imposed by the district, it's imposed by the state. So it's important that you adhere to that, because if you don't make your changes before then, you will be enrolled in whatever plan you are in now. Or if you're somebody that previously waived coverage and would like to opt back in, if you don't complete that before the 31st, you will be without insurance. So it's very important that you make sure that whatever elections you're making or changes or enrollment, that you do that by the 31st. Enrollments are only processed through Benefit Solver. I highly recommend that if you haven't been on your Benefit Solver account, please make sure that you have access to it and can log into it. We had a situation last year, not at this district, but at another group, that the person tried the last day of enrollment to go ahead and access Benefit Solver. They were having an issue logging in. They were not able to get through customer service at the state, which is who manages Benefit Solver, and they unfortunately were not able to make the changes that they wanted for open enrollment. The state is overwhelmed towards the end of open enrollment, so if you're leaving this for last minute, that's something I would not recommend. Make sure that you have access to your Benefit Solver account, that you can log in. There are no paper forms, whether you're waiving or enrollment. It's all done through Benefit Solver. Benefit Solver also has an app called My Choice Mobile, which is available, and you can also manage your enrollment and or changes through there. And while this is a passive open enrollment where there is no action required from members, we do, however, recommend that you log into Benefit Solver, confirm that your information is correct, your home address, especially if you've moved recently, and that your plan elections and the dependents that you want to enroll in your plan are correctly loaded on Benefit Solver. Benefit Solver can be accessed by going to mynjbenefitshub.nj.gov. We actually have a link for the Benefit Solver website on the IMAC portal. For those of you that have created an account, you'll just need your username and password. It'll then send a 6-digit security code to your cell phone in order to log in, because again, that's part of their two-factor authentication. But if you haven't enrolled or created your account, you would need to click on register in order to begin that process. This is what your dashboard once you log into Benefit Solver looks like. Across the top here, because we are in open enrollment, you'll see a countdown of how many days are left for open enrollment, and that's where you would click to go ahead and make any changes or waive your coverages if that's the case for you. If you're looking to download the Benefit Solver app, again, it's called My Choice Mobile. It's available for Apple and Android phone users. This is what it'll look like either in the Google Play Store or in the Apple Store, this blue icon here. So again, My Choice Mobile. For those of you that are adding dependents for the first time, please make sure that you are supplying the state with the appropriate information regarding that dependent. So for example, if you're getting married and you're looking to add a spouse, you will need a copy of your marriage certificate. If you've been married over a year and are looking to add that spouse now during open enrollment, you will be required to also submit a copy of a joint tax return. But if you are somebody who's adding on a dependent child, whether it's a child of natural birth or stepchild or foster child, there is documentation that is required for that, usually the birth certificate and any other applicable documents depending on the status of that dependent child. But if it's a child, a baby that you and your family had, again, that would be just the birth certificate. So please make sure that if you are adding on any dependents for the first time, you're doing that through Benefit Solver and you're supplying the correct document verification as requested by the state. During the 2024 open enrollment, you will have 4 plan options available to you. They are available now as of earlier this year. You can get the plans through Horizon or Aetna. Horizon only offers Direct 10, 15, and the Educators Plan. Aetna offers the Freedom 10, 15, Educators, and Garden State Health Plan. So again, the big difference there is that Horizon does not offer the Garden State Health Plan, only Aetna does. The plans are all identical to one another. The rates are identical to one another. The only difference is the network. So for example, if you're somebody who is in the Educators Plan under Horizon, but the Aetna network has more of the providers that you're interested in, you can switch into the Aetna equivalent of the Educators Plan. And again, the rates are going to be the same. The benefits are going to be the same. The only difference is the carrier network. So it's a matter of really deciding whether or not you want to have more providers in the Horizon world, if that's, where most of your providers lie, or in Aetna. We've spoken to members that have switched over into the Aetna equivalent plans because certain specialists that are out of network for them under Horizon are in the network for them under Aetna. So that is completely an option that all the members have to switch into either Aetna or Horizon. However, if you are somebody that was hired on July 1st of 2020 or later, you are only eligible to join the Educators Plan or the Garden State Health Plan. So your date of hire is what determines what plans you have available to you. One of the questions that we get a lot is, if I'm in Direct 15 and I switch into the Educators Plan, can I go back? And the answer is yes, so long as your date of hire was before July 1st of 2020. It's a common misconception that people think that if they switch from Direct 15 to the Educators Plan that they will never be able to go back, and that's not true. The state determines the plans that you're eligible for based solely on your date of hire. We do have plan comparisons on the IMAC benefits portal as well as on Benefit Solver. So you can certainly see a side-by-side comparison of all the benefits. If you're considering, for example, switching from Direct 15 to the Educators Plan, you can see a side-by-side on there that really makes it simple to just see the same benefits, how they're covered under each plan. One of the other popular
Liz?
questions. Yes, yeah, go ahead.
It was, to everybody out there, it was also included in all the emails that were sent. The
Great.
side by side, your calculator, if you open up your emails, you'll see all that information there as well.
Perfect. Yes, thank you very much. Yeah, we love over communicating, and I know that sounds annoying, but again, there's only 1 month to go ahead and complete your open enrollment, and we want to make sure that you have access to the information, whether you check your email, whether you check the portal, whether you check Benefit Solver. We want to hit you from all angles to make sure you have all the information you need to make an educated decision. So one of the other questions that we get a lot is, how are your contributions calculated? So for anyone who is in the 10 or 15 plans, that is based on Chapter 78, as you can see here all the way on the left. It takes into account the coverage tier. So if you're enrolling yourself, a family, parent and child, 2 adults, your salary, and the premium of the plan. So for those of you that are in Direct 10, Direct 15, your premiums are going to be going up come January 1st, just because the rates go up every year. But as you can see, those of you that are in the Educators Plan or the Garden State Health Plan, those contributions are based on what's called Chapter 44, and they only take into account the coverage tier and the salary. The premium of the plans are not part of the calculation here, which is why there is a guaranteed savings to switching into the Educators or the Garden State Health Plan, and why the rates are stable as far as your contributions, because so long as your coverage tier or your salary doesn't change, your contributions stay the same. So that's a big, big difference that we like to highlight. But again, as we will get into, there are plan differences that are also important that you're aware of. And to Maureen's point, we do have the contribution calculator. It's on the portal. I highly encourage everyone to go ahead and utilize it. And if for whatever reason you don't have access to Excel or have trouble using it, please feel free to call our office. We will run those numbers for you, or you can send us an email, whichever's easier. As long as we know your salary and your coverage information, we can tell you what your costs would be across all 4 plans. For the educators plan, again, because it utilizes that percentage based on your salary, someone, for example, who makes, let's say, $75,000 and they have a family, they're only paying 5.5% of their salary as far as their contributions. So you would take that 5.5%, multiply it against your annual salary, and if you're a teacher, you divide that amongst 20 pay periods because you're a 10thly employee, and that's how you determine what your per pay contributions are. So again, we can run the numbers for you, but the table makes it really straightforward as to determining what those contributions would be. There's also a table for the Garden State Health Plan, which, as you can see, the percentages are a little less. But again, the Garden State Health Plan, as we will get into, has its own set of restrictions. So just to highlight some of the medical plan differences, the educators plan utilizes the same network of doctors in the 10 or 15 plan, whether you're going under Aetna or whether you're going under Horizon. So if you're in Horizon Direct 15 and you're looking to switch into the educators plan, that is the same network. That is called the Horizon Managed Care Network. If you are in the Aetna Direct 15 plan, or Freedom 15 as they call it, and you're switching into the Aetna version of the educators plan, they utilize the same Aetna Choice POS2 network. So I guess as far as network, the 10 and the 15 are the same networks as the educators plan. The Garden State Health Plan, however, does utilize a different Aetna network, which is a smaller, more reduced network, and the coverage in the Garden State Health Plan is only in the state of New Jersey. That is a very big takeaway, which is why we have it highlighted. The Garden State Health Plan, it is really not a great plan if you're somebody who has, for example, a child away at college, or if you're somebody who goes out of state for services, such as into New York City with hospitals like Memorial Sloan, Columbia Press, Hospital for Special Surgery. There is no coverage outside of the state of New Jersey unless it's a true medical emergency, which is defined as a threat to your life or a threat to the loss of a limb. Contributions for the educators plan and the Garden State Health Plan, as we showed previously, are determined as a percentage of salary, rather a percentage of the premium, which is why there's the savings there. Both plans have a $10 copay at your primary care physician's office, $15 copay at a specialist's office, and the emergency room is a $125 copay, which is waived if you're admitted into the hospital. As we said at the beginning before we started the meeting with some of the questions that came through, the two major differences with the plans compared to Direct 10 and Direct 15 are the out-of-network, which again, if you go to out-of-network providers under the educators or the Garden State Health Plan, you will have higher out-of-pocket costs because they're reimbursing those out-of-network providers less. And also the use of a different formulary or list of drugs in which members pay the difference between the drug cost if you're using a brand name that has a lower cost generic option available, because the plan has a mandatory generics requirement, which we will get into in its own slide coming up. Just to do a high level comparison here, as I said, whether you're going in Direct 10 or in Freedom 10, the plans have the same networks across the board for 10, 15, and the educators plan, as you can see. In Horizon World, it's called the Horizon Managed Care Network. In Aetna World, it's called the Aetna Choice POS2 network under those 3 plans. For the Garden State Health Plan, however, it does utilize it's only an Aetna plan, and it only utilizes that Aetna Whole Health New Jersey network, which, as I said, is a smaller network than the Aetna Choice POS2 network. The 10, the 15, and the educators plan does have, all 3 of those have national coverage, whether it's the Blue Card or the Aetna National Network. But again, the Garden State Health Plan only has coverage in the state of New Jersey. Very important takeaway there. Your copays for primary care and specialists are similar, but again, depending on the plan, will vary either between $10 or $15. Your annual physicals are all covered the same way across all 4 plans. Only in network, they're covered 100%. No copay required for that. And your annual deductibles, all 4 plans do not have any deductibles in network. So the moment your coverage begins, you don't have to lay out any money. Your coverage just starts in network. But out of network, you are subject to your applicable deductible, excuse me, whether it's for single coverage or for a family coverage, which is why you're seeing those two sets of numbers. Same thing with out-of-pocket maximum, which is the most that you would lay out in a calendar year. You have different limits, whether you are in the network or out of the network, which we have laid out here and also included in all the plan overviews that were emailed to you. All four plans do not require a referral when you go to the doctor's office. So you can go ahead and schedule to go to a specialist without having to get a referral under your primary care physician under any of the four plans. We're getting a question here, is the deductible per person? The deductible is up to two members of the family and for the family together. So for example, I'll use in the Direct 15, the out-of-network deductible is $100 for an individual or $250 between two people. So two people would have to meet that $250 limit. Same thing with any of the family rates under the out-of-pocket max. So the out-of-pocket max, for example, in the Direct 15 is $5,000. That would be met by two people. So again, that's important to note there how that functions. And they consider those deductibles, which they call family, as long as they're met by two people. So whether it's two people or more in your enrollment, it has to be met by a minimum of two people. So just going back to your lab work, your labs are LabCorp and Quest in network. If you go out of network, you are subject to your applicable deductible and coinsurance. Same thing with outpatient surgery. There is no charge for that inside of the network across all four plans, but out of the network, you are subject to your applicable deductible and coinsurance. And again, your emergency room copay depends on the plan that you enroll in. But if you are waived, if you are admitted into the hospital, it is waived in any of the four plans that are offered. So that's important to note as well. So to answer one of the questions that came up at the beginning of the meeting regarding out of network, so both the Garden State and the Educators Plan utilize what's called the CMS table or Medicare table, and that is the table that determines what those out of network providers get reimbursed. The table is a less reimbursement or of a lesser reimbursement amount than the Fair of Health, which is what's used in the Direct 10 and the Direct 15. So as we said at the beginning of the meeting, people that switch into the Educators or the Garden State Health Plan will have higher out-of-pocket expenses by going to out-of-network providers because those out-of-network providers will be getting less money. So that's very important to know. Again, if you're somebody who goes out of network maybe once or twice a year, it may be an option for you to switch into those plans because you'll have significant savings that you can use towards those higher out-of-pocket costs. But if you're going with a certain degree of frequency, that's a red flag that should give you pause to think about, is this a good option for you or not? I have this little example that I put together just to illustrate how out of network functions. So for example, if you go out of network and that provider bills you $100, Horizon or Aetna, depending on which one you choose, because again, they're offered by both carriers, will determine what to reimburse that provider. Again, and they determine that based on where the provider is located and the code for that service that was rendered. So in this example, let's say Aetna or Horizon, they allow $50 of that $100 total bill. They will pay their 70% of coinsurance, which is this blue box, which is $35. You as the member would pay your 30% in coinsurance, which is this orange box here, the $15. And that other $50 that we haven't even brought into this equation yet is what's known as balance billing. You as the member would be responsible to go ahead and pay that provider to make their bill paid in full. That this red box here does not get applied towards maximum out of pocket. So it's important that you take note of that when you're getting services out of network. If you're somebody who's in the Educators Plan, you can certainly speak to that provider and say, and ask for what's called a predetermination of benefits. So they can go ahead and speak to the insurance carrier, figure out what they're billing, what's covered, and what would be your out-of-pocket expense as the member. But really, not all doctors comply with this. I can tell you that I've spoken to members that their doctors, they don't participate with any insurance because they plainly just don't want to be bothered. So it's important that you understand that when you're inside the network, you're subject to your copay, you can manage your costs, but when you go out of network, it really is like the Wild West out there because it's very challenging to control your costs because you really don't know what codes are going to be used, if that provider is willing to even make that call to Horizon or Aetna to make that predetermination of benefits. If you still have any other questions about out of network, I would highly recommend that you reach out to us. We love speaking to members one-on-one about how they utilize their benefits and what plans work best for their specific situations. So just to get into prescription in the educators and the Garden State Health Plan is the same. Generic drugs are $5. Preferred brand drugs are $10. A non-preferred brand, which is a brand that is either not covered at all or a brand that has a generic option that's available that you as the member are choosing to take, for example, that is completely, the member is basically paying for the entire cost of that drug. That's important to note because I'll use Crestor as an example. Crestor is a brand name medication for cholesterol. They do have a generic option available. Crestor is completely excluded from coverage. So if you want to take Crestor and that's what you're insisting on taking, great. You will be responsible for the entire cost of that medication. That's important to note. And going back to the person who asked before about, if you're allergic to the generic, when a drug is not covered or completely excluded, it's as straightforward as that. So it's important to note to make sure that this plan is going to work for you, not only on the out-of-network end, but also on the prescription end, because the prescription and the medical go hand in hand. So if you switch into the educator's plan, you cannot keep the current prescription plan that you have under your Direct 15, for example. Very important distinction to make. Your mail order is $10 for generic drugs, $20 for preferred brand. The reason those costs are a little bit higher is because at retail, you're getting a 30-day fill, whereas under mail order, you're getting a 90-day fill. So if you are on medication that they call maintenance medication that you're going to be on for the foreseeable future, you may want to consider mail order for that because you're going to be paying a lesser amount for that medication and getting a bigger fill for it. So again, very important to know that. And again, the prescription plan and the educators and the Garden State Health Plan does have that mandatory generics requirement. There is step therapy, which means that they will start you out with the lowest cost medication first and then move you up the ladder within, let's say, generics, because there are generics that are more expensive than others. And it is a smaller list of drugs. That is not to say that certain conditions won't be covered with medicine. There will always be a drug for every single condition. It may not be the one that you and your provider would like, which is important for you to make sure that you do your research on Optum's website to make sure that the drugs that you are on or want to be on to see how they're going to be covered. So when you go to OptumRx's website, and we do have a link here on the portal, I see a question here. And I'm sorry, but I figured let's answer these in real time. The person is asking, why is NJ Direct in-network out-of-pocket so much higher than other plans? That's a question we get every year, believe it or not, and I'll go back to that slide. That's determined by the underwriting over at the state health benefits. And the person's referring to this out-of-pocket maximum in-network. That is a very scary number when you look at it. But once you understand how it's actually accrued, I don't think it's a scary number. So for example, an individual who has Direct 10, their out-of-pocket maximum within the calendar year, or the most that they would spend in a calendar year in network, is $7,360. That is comprised of your co-pays for prescription and for medical. It's also comprised of any services in network that are not covered 100%, such as durable medical equipment, private duty nursing, and the ambulance, which are covered at 90%. So again, for you to actually even meet that number, not that you would have to meet it, because again, it's the most that you would spend in a calendar year, you'd have to be very ill and go to the doctor many times at $15 copays, for example, in order to even exceed that. So again, it's a very scary looking number, but it's something that the underwriting teams in the state, that's how they have the plan set up. It's been like that for a very long time, so this isn't brand new that they are increasing those numbers. That's just the way that the plans are. The person is asked, same question we got with regards to the Direct 15 and the educators plan. Yeah, that's just how underwriting puts it together. But again, in network, it's accrued exclusively from co-insurance on ambulance, private duty nursing, and durable medical equipment, as well as co-pays. So that's just how the underwriting team has it. So going back to prescription here. So to do your search on OptumRx's website, you would be clicking on the link that says local education employees, because that's what you are in the state. Again, we do have this link on the portal right now. And once you click on that link, it'll bring you to, you can search for pharmacies, prescription drug lists. So for example, if you were searching to figure out how, what drugs are covered under the educators plan, you would pick an NJ Educators and Garden State Health Plan, MMRX, because that's what you have. And then once you click on that, you would actually type in the name of the medication that you'd like. So in my example here, I used Crestor because again, it's a very popular medication. So Crestor, as I was mentioning, is an excluded drug because it is a brand name medication that has a generic option available. So as you can see, once you do your search, it actually will tell you if the medication is covered or not. So in this case, Crestor is completely excluded. So if the member wants that drug, they would have to go ahead and pay for it out of pocket. But the generic is covered, and it is a tier 1 generic, which means it is a $5 copay. And it'll show you which are the generics for the drugs that you're looking for. I can tell you that a drug like Ozempic, which does not have a generic, is a covered drug, believe it or not, even though it's a very costly medication. Again, you would have to meet the medical necessity criteria for it of having diabetes in order to qualify for it. But again, it is a covered drug. So it's not to say that only generics are covered. Okay. Maureen, anything that you'd like to add on about prescription?
Okay, if something says it needs pre-approval, can you just tell us a quick synopsis of how they go about doing that?
So I'll use Ozempic as an example. Ozempic, because it is a very costly medication and does require what Maureen is saying, which is called prior authorization, that basically means that the insurance company, the clinicians over at Optimum RX, have to go ahead and confirm with your doctor with medical notes why you need to be on Ozempic. So for example, they will have to provide a diagnosis of diabetes. They'll provide, what your A1C levels are. They will have to provide that you've been on other medications that don't seem to be addressing the issue. Again, really making the case why you need Ozempic or any drug that requires prior authorization. When you actually do your search for medication on OptumRx's website, you will actually see if the drug, you will click on it and you can actually, it'll tell you if it requires prior authorization. But again, prior authorization, kind of like when you're going to go get an MRI. You can't just walk into, Montclair Radiology, for example, and say, hey, I need an MRI. No, you have to go ahead. Your doctor has to submit clinical notes to Horizon, for example, let them know based on previous testing, such as, let's say, an X-ray, why you need an MRI done, because again, it's a very costly service. Same thing if you were going into the hospital for knee replacement surgery, you would have to go ahead and get that pre-authorized because the insurance company wants to make sure that it is medically necessary. So yeah, good question about prior authorization. Prior authorization, by the way, for if a medication requires it, there is no specific time frame that I can tell you. I know that I worked with a member who, and I use Ozempic because it's such an important popular drug for people that have diabetes right now. It took this member almost a month to get the prior authorization completed because the doctor had to submit notes multiple times. The clinicians over at the insurance company had to review it. So it can take some time to get a prior authorization in place. A question that we're seeing here in the chat is, what if there is no generic for a drug such as loetrozole? Will that be covered? If that specific drug, which I don't know off the top of my head, if that's covered, there will be other drugs within that same therapeutic class of medications that will be covered. So going back to the statement I made earlier about, if that drug that you want isn't covered, that doesn't mean that they're not going to cover any drugs for that condition. There will always be a drug for every single condition. But again, you would have to go ahead and Do that search to see if your drug is covered. And if it's not, that's a conversation that you would have with your provider to see what other alternative drugs would help treat the condition that you have. And you can do the search on Optimum Rx's website to see how that would be covered. The member is also asking here, what about insulin? Will the meter be covered, the pads, the machine? Is there a difference between type 1 and type 2 diabetes? There are insulins that are covered under the educator and the Garden State Health Plan. Absolutely, that is, diabetes is a major disease, especially here in the United States. The supplies and the medication that go with it will be covered. I will make a note about the insulin that insulin is a very specific drug for people that have diabetes. It is not a drug that you can just willy-nilly make a change. Again, if you are currently a diabetic, I would highly recommend that you do the search on OptumRx's website to see if your insulin is covered. And if it's not, it'll let you know which ones are. Because again, there's different insulins depending on long-acting, fast-acting, and whether or not you have type 1 or type 2 diabetes. So it's important that you do that research, because if the drug that you're currently on that you want or need to stay on is not covered, that's a problem for you. Other question here, at times doctors won't provide the list of drugs ahead of time. Can we have a list of the drugs that are not covered instead? The state does not put that information out just with one document that you can bring your doctor's office. I can tell you, as someone who, helps my own parents with medications and whatnot, I'm constantly having to call the doctor's office back to say, hey, this isn't covered by their Part D Medicare plan. Can you let me know what other drugs would treat this condition so we can go ahead and see if they're covered. The database is, like I said, it's available on OptumRx's website, but they do not have a full PDF, I believe, that they can print out, because there are just a lot of different drugs out there. And on top of that, as new drugs come onto the marketplace, that list is ever evolving, which is great that they have it available for you online. But there is no one such document that is written in stone. The list is always subject to change as new drugs are approved by the FDA. Good questions, though. And just as another function that I wanted to share with all of you regarding OptumRx's website, you can also search for your local pharmacies to see how much a drug is. People would be surprised at how much drug pricing varies whether you go to CVS, Walgreens, or a local pharmacist shop in your town. So what I love about OptumRx's website is that they go ahead and they actually can give you a breakdown of costs between multiple different pharmacies in whatever zip code you put in there. And again, I highly recommend mail order, because again, if you're using a blood pressure medication or a diabetes medication or anything for a chronic illness, mail order is going to give you the most bang for your buck. It'll be delivered to your house, and it's terrific. Members love it. So with that said, again, I highly encourage anyone who has a prescription question as well to reach out. It's an important decision that you're making when you're if you're considering a switch. So we definitely want to go over that with you if you have any other questions about it. So next steps, as we spoke about in the beginning of the meeting, if you do not have any changes to your benefits, there is no action required on your behalf. Just please make sure that your information is correct in Benefit Solver. And if you are making a change, let's say to dental or anything like that, that is the only plan that would require a form. But for the most part, people aren't making any changes to dental. It's really medical and prescription that people think about during open enrollment. If you are waiving your coverage, you do have to do that through the Benefit Solver portal or app, whichever is easier. And again, if you are waiving your dental as well, you would need to complete a form for that. With Benefit Solver, just make sure that you register first in case you've never been on the... Go ahead, Maureen.
1 second. Our dental is not through the state. Our dental remains with Delta Dental, and there is no changes or open enrollment for that.
Perfect. As I said, you also have the IMAC benefits portal to evaluate all the plans that are offered, where you can go ahead and do a comparison side by side, as well as utilize the contribution calculator. And just please note, you are making a plan election for the entirety of 2025. You are eligible to switch plans again during October of next year for an effective January 1st, 2026. But again, you are committing for a full year. And again, just to reiterate, if you're someone in Direct 15, and again, you were hired on before July 1st of 2020 and you're switching into the educator's plan, you can always switch back next year. You're not stuck or in there, or you're not going to lose the ability to go back to your direct 10 or 15. And again, the big takeaway is any changes for open enrollment must be done by October 31st. The state will not honor any changes done after that. We do have the portal, and again, I'll highlight it again. If you don't have it bookmarked, I highly encourage you to do so. The website is imacbenefits.com. There is a guest key, and that is the only information that you'll need to sign in, which is CWCBOE, all in caps. So very important that you jot down that information. I'll leave it up in a minute because we do have a question here coming up. The person is asking, if I have Direct 15, I can have the non-generic prescription. If I have Garden State or SEHEP, you can only get generic. All right, let me answer this because it's a little all over the place there. Direct 15 is your current prescription plan. And that is, again, you don't have any restrictions there as far as, non-generic versus generic. So you don't have that issue to contend with about mandatory generics. In the Garden State Health Plan or the Educator's Plan, it does have a mandatory generics requirement. So if there is a lower cost generic option available, let's say your doctor writes brand, but there is a lower cost generic option available, that's what's going to be dispensed at retail. You as the member can choose to get the brand, but you'd be paying for it completely out of pocket. Very important to know that. So just going back here, so that's the IMAC benefits portal. And again, as we said at the top of the meeting, we do have the 2025 calculator posted on the portal. You would pick the applicable plan that you're looking to get rate information for. And again, it's important that, you can go ahead and utilize the calculator, but you have to have Excel 2013 or later. If you try and open it in Google Sheets, it will not work. So please feel free to reach out to us. We will run those numbers for you, or send us an email with your salary and your coverage tier, and we'll let you know what your contributions would be. Someone else is asking and saying, I have Direct 15 and I am always made to choose generic. What happens nowadays is it's not that you're forced to choose generic, but in the pharmacy world, at like my CVS, for example, they primarily dispense generic drugs because either they know how it's covered, that only generics are covered first, or because the member always wants to pay the lowest cost option available. It's only when you go to actually confer with the pharmacist that you tell them, hey, I know that it says this, but I actually want the brand name, that they'll give you the brand name if there is a generic option available. I see that all the time. Mostly generics are what are dispensed at pharmacy. So while open enrollment is happening right now, we understand that life happens outside of open enrollment. So we just like to reiterate that if you have a life event, for example, you get married, you have a baby, you have a divorce, or God forbid, a death in the family, you do have 60 days to complete or make any changes to your enrollment and submit that documentation on Benefit Solver. If you are someone who is looking to terminate coverage because you are gaining it elsewhere, the state only allows you 30 days for that change. And whether you are making a change because of a qualifying life event or if you're terminating because you're gaining coverage elsewhere, the coverages will be retroactive to the date of the event. Open enrollment, as we said, happens every October for an effective January 1st date. And again, during open enrollment, you can add or delete dependents, change in between plans, waive coverage, or enroll if previously waived. For those of you that have dependent children that are aging out, we always like to touch upon this subject because it's important. So your children will be covered until the end of the calendar year in which they turn 26. At the end of that year, they may have the following options available under the state. They automatically will be offered COBRA. And again, they'll age out, for example, December 31st of this year, if their birthday was, if they turn 26 in this year. So they'll be automatically offered COBRA. But if they meet certain criteria, they may be eligible for something called Chapter 375 or Dependent 31, which is a New Jersey state mandate that we'll get into in the next slide. And if you have a special needs dependent, there is coverage continuation for overage dependents with disabilities. We do have those forms on the portal. And it's important that you know that there is paperwork that the state would require if you have an overage dependent that is disabled. And part of the paperwork would be to have that completed by your dependent's physician. But if that is a situation that applies to you, feel free to reach out to us. We'll go over that one-on-one with you. So as I was saying, the New Jersey state mandate, which is called Chapter 375, if your dependent is aging out and they are not married, have no dependents of their own, live in the state of New Jersey or are a full-time student outside of the state, and are not entitled to any other coverage, whether it's Medicare or group coverage, they may be eligible to join and do Chapter 375, where they would enroll in the same plan that you're in currently, and they would be billed 60.8% of the single rate of that plan. We mention this at every open enrollment because it's important to note because it is a much lesser expensive option than COBRA. COBRA bills 102% of the premium, which is very costly for people. But again, this is another alternative that's available so long as that dependent meets the criteria. We do have a link for this on the portal as well, and also in Benefit Solver. So for those of you looking to search for a provider within the Horizon world, you would go to horizonblue.com/doctor finder. Again, very important to note that under Direct 10, Direct 15, and the Educators Plan, it's the same network of doctors. So there's really no need to figure out whether or not, if you're switching from Direct 15, if that provider is in network under the Educators Plan, because they utilize the same network. Under the Aetna plans, however, the Freedom 10, Freedom 15, and the Educators Plan under the Aetna network, they do utilize a different network than the one in the Garden State Health Plan. So if you are making a switch into the Garden State Health Plan, definitely important that you do a search to see how those providers that you are interested in continuing to go to, how they are covered. NJ Well is something that's available completely to all state education health benefit employees, whether you are in Horizon or in Aetna. You probably already do a lot of these activities, such as your your annual physical, dental checkups, and many other wellness activities that you accrue points to go ahead and earn a $250 gift card. You can do that for yourself, and if you have an enrolled spouse on your plan. You would go to nj.gov/NJWell. We also have a link on this on the portal. And the cycle runs every November 1st through October 31st. So we're wrapping up the 2024 cycle. We're about to begin the next one. It's really money that you're leaving on the table by not participating because, like I said, you're most likely already doing a lot of these preventative wellness activities. We also have posted on the portal, and I believe Maureen sent this out, the plan overviews from Horizon and from Aetna. These are really neat because they go into a lot of detail as far as side-by-side comparisons of all the plans, as well as any other additional discounts, such as for gym memberships and whatnot, that both Aetna and Horizon offer. And with that said, really wraps up our presentation. I'll give it a minute or two for any other questions that are coming in through the chat. Again, the biggest takeaway here today is October 31st. If you're making any changes, that is the important takeaway, that you do those changes before then. Maureen, is there anything else that you'd like to add?
Hi, I just sent out instructions on how to get to your benefit solver account. Just like Liz says, it is imperative that you go on before. You don't want to be on the 31st and you can't access it. So if you have yet to
Absolutely.
do so and create your benefit solver or ever log on, please log on, tomorrow. And you don't have to make your decision tomorrow, but at least your access is good.
Perfect. The only other question that I see here is this person is asking what percentage of our salary goes to Direct 15. It depends on your salary. There is a table, what's called the Chapter 78 table, and that is what the state utilizes to determine contributions. So based on your salary and whether you're covering single, two adults, parent and child, or family coverage, those tables will show a percentage of what you will be contributing from your salary. I can tell you that the math can be kind of wonky and hard to calculate, which is why I highly recommend the calculator, because it really, by you entering in your salary and clicking on whether you're, enrolling a family, single parent and child coverage, it'll tell you exactly what your contributions are. But those Chapter 78 tables, they're available on the state's website and on Benefit Solver to let you know what that exact percentage is. If you put your salary in the chat, or if you want to call me, I can actually tell you, because I have those tables in front of me right now. I usually keep them taped up next to my desk, so.
Also, remember, it's
yes.
only your pensionable salary.
Yes.
If you receive a stipend for something, that is not pensionable. So only calculate at your pensionable salary. And the calculator that Liz provided, that's the number you're going to put in.
For example, and I'll just throw this out there again, there are different tables depending on whether you're covering single, family, parent and child, and family. I'm sorry, 2 adults. So those 4 different coverage tiers. But for example, somebody who makes $75,000 and they have a family plan, they are contributing 23% of their salary towards their benefits. So I hope that answers that question. One of the other questions that we have gotten, and I know Maureen and I were discussing this, is the increase that's coming for 2025, which is why I think we're getting a lot of questions about the educators plan. The plans for those of you in Direct 10 and in Direct 15, they are going up 21% come January 1st. So you will see that reflected in your payroll, in your contributions after January 1st. So again, it's important that you think now whether or not the educators plan may be a good fit for you, because like I said, you will have a guaranteed savings, but there are benefit differences very specific to out of network and prescription that should definitely be looked into, and see how they would be, how those benefit changes would work on your end. Another question that we're seeing here is, I remember Direct 10 and 15 used to be teachers only. Has this changed? In the state health benefits, the state divides, there are 3 categories of employees. You have local education, which is what Caldwell, West Caldwell falls under. There are local government, and then there are state employees. So in your pool right now of plans in the state, that is, these contribution numbers and these plans are available to all public education, local education employees. I hope that answers that question. Other than that, like I said, you do have until October 31st to make your changes. In the meantime, feel free to give our office a call. Our information is right on the screen. And you can go ahead and give us a call. Last question that I'm seeing here is, are we paying a higher premium than other state employees? Yes and no. You are paying a higher premium than local government, for example. But again, it's all based on claims experience and the plan designs. Your plan designs are a little different than local government. So again, at the end of the day, when you're in state health benefits, you are subject to whatever increases they decide. You are subject to whatever plans that they are offering. And I know someone reached out the other day and asked me, who can we talk to about lowering premiums? Unfortunately, this is decided at the state level. So I would imagine your local state congressman or your local government, but really that's how that's decided. All right, everybody, I really appreciate your time today. Again, feel free to reach out to us one-on-one. Maureen, thank you so much for putting this all together and for being amazing with everybody over there and communicating all the important open enrollment information materials that we have this year.
Thank you, Liz, for giving us further information on making decisions.
Perfect.
We will also be holding a live presentation on October 16th at 3 o'clock at the middle school. So if you have further questions and you'd like to speak to Liz in person,
I will be there in
or
person.
myself,
yes, I'm excited. Yes.
So that will be October 13th. It will be held at the middle school in the cafeteria.
No, I'm sorry, October 16th, that Wednesday.
16th.
Yep, Wednesday the 16th. Actually, one week from today.
Right, it'll be held in the cafeteria at the middle school. So please feel free to come again and ask any other questions that you'd like to ask to make a better decision.
Excellent. Great. Thank you so much, everyone. Have a wonderful evening.
You too. Thank you.
Thank you. Bye-bye.